We called them pioneers, trailblazers, test subjects in a grand experiment that would affect not only their own futures, but ultimately the futures of individuals, families, and entire communities throughout Kansas. Would it work? Could Wichita support a 4-year medical school? Only time and the success or failure of these 8 students would tell. No matter how many might follow in their footsteps in the years ahead, they would be the first to overcome the perceived limitations, to challenge the conventional wisdom, to show it could be done. Today, after a full 4 years at University of Kansas School of Medicine-Wichita, these 8 stand as living proof of the program's success. The KU School of Medicine-Wichita is unique in its community-based approach. In contrast with the typical medical school model, which is tied to a single university hospital, the Wichita campus partners with healthcare facilities across the state to provide hands-on clinical training for students and residents. Graduates of our family medicine programs typically score well above average on their in-service exams. The success of this program comes at a most critical time, as Kansas faces a severe and growing shortage of doctors. Today, nearly 60% of our state's primary care physicians are over 45, and a third are over 50. It is estimated that in the next 15 years, Kansas will need nearly 250 additional primary care physicians. Where will these new doctors come from? Health experts agree that at the current pace, there is little government or the medical profession will be able to do to close the gap. But at least part of the solution is here, at our doorstep, embodied in the continued growth and success of the KU School of Medicine-Wichita. A recent study ranked this school 6th in the nation for producing primary care physicians. Historically, nearly half or more of these new physicians remain to practice in Kansas. For the rural communities that host them, and for the underserved urban areas in which they may choose to practice, these new doctors bring more than professional medical care. They bring hope. A community with a doctor is a viable community. By definition, it enjoys a better quality of life. Businesses and industries are more likely to relocate or remain here. Employee sick days drop right along with time and distance to needed care. Residents and family members find the care they need right here, close by. A bond of trust forms between doctor and patients, a relationship that has proven time and again to result in better overall health, lower death rates, and lower total healthcare costs. If one doctor can bring new life to one underserved community, imagine what 8 doctors can do, and 16, and 32, and 64. An annual class of 65 first-year medical students is the goal for the Wichita campus. Today, it is no longer a question, no longer just wishful thinking. Today, the University of Kansas School of Medicine-Wichita is producing doctors for Kansas.